Good day to all of you. I am Dr. Arkhe De Leon, the Dental Architect. So before I give you the 10 tips of how to avoid dental cavities, let me first explain the fluoride. Fluoride is one of the most important minerals to avoid dental cavities because it has an antibacterial properties, can neutralize acidity on your teeth, and it strengthens your teeth. It changes the composition of your teeth, which will make it stronger. So now you know what fluoride can do. The first tip that I can give you is toothbrush and floss. Toothbrush and floss is the mechanical way of removing bacteria and food debris in our teeth, because cavities came from bacteria eating the food which contains sugar. The bacteria will produce an acid, and the acid be the one that will cause dental cavities. And the longer the acid is in your teeth, the more it will destroy your teeth. So with the brushing and flossing, you will be able to remove the food, you will be able to remove the bacteria, so there won't be any acid that will be produced, to lessen the time that the acid will stay on your teeth. So toothbrush and floss twice a day, in the morning and in the evening. As long as your brushing is correct, twice a day is enough. Tip number 2, the toothpaste. Toothpaste is very important because it has abrasive particles which will help you clean your teeth. At the same time, it also has fluoride. Using toothpaste that will cover the whole teeth will serve as a better protection for your teeth. Because there's a toothpaste on your teeth, bacteria and food will not stick on your teeth. That's why after brushing your teeth, do not rinse it with water. Just spit the excess toothpaste and you can go to your daily lives. Because once you rinse the toothpaste away from your teeth, you will be removing the fluoride that is protecting your teeth. Tip number 3, mouthwash. As I told you, do not rinse off the toothpaste in your teeth. With the mouthwash, you will be removing the toothpaste. It is okay to use a mouthwash if it's a fluoride mouthwash which will replace the fluoride that was lost. What I suggest is you only use mouthwash whenever you cannot brush your teeth. I told you, you brush twice a day, morning and evening. During in between, whenever you eat sweet, you eat some food that is high in carbohydrates, you use your mouthwash to lessen the bacteria and the food debris. You can do your mouthwash after lunch or after your merienda or your snacks. Tip number 4, lessen the sugar, carbs, and starch in your diet. These foods, especially fermented carbs, are very cariogenic. What do you mean by cariogenic? It can produce lots of caries on your teeth. It's okay to eat sweets some time of the day, not every day, not 3 times a day. Once a day is okay. But eating sweets 3 times a day, drinking milk tea 3 times a day, drinking sweet beverages 3 times a day, that will cause harm on your teeth. But if you cannot avoid eating sweets, just do your mouthwash or your brushing after eating those sweet and sticky foods. Tip number 5, drink lots of water. Water will rinse your mouth. Every time you drink water, some bacteria and some food will go with it, so it will not stay on your teeth. And at the same time, it will increase your saliva, because saliva is good for the teeth because it will give nutrients to the teeth. It has calcium and different minerals. It will neutralize also the acidity in your mouth, and it will wash away the bacteria or debris. Tip number 6, avoid sudden change of temperature. We all know that when you apply something cold, it will shrink, and when you apply hot, it will expand. All the boys know it. The molecules of your teeth, when you eat hot water, it will expand. And because it's hot, you're gonna drink cold water, what will happen? It will suddenly shrink. The shrinkage was so fast that it can cause cracks. And those cracks will cause big problem in the future. Tip number 7, chew your fibrous foods and vegetables. The more you chew them, the more you grind them, the cleaner your teeth will be. Because every time you bite a fibrous food, the fibers will clean your teeth. The more you use your teeth, the cleaner it gets. Tip number 8, no matter how scared you are to us, dentists, you still have to visit the dentist twice a year. Because the dentist can tell you what you need and what you have to avoid. Visit the dentist and have an x-ray and you will know a lot about your teeth. Tip number 9, have your dentist apply fluoride varnish on your teeth. Okay, a toothpaste has 1,500 ppm of fluoride, that's the concentration. And the fluoride varnish that the dentist apply has 22,500 fluoride. So just imagine the amount of fluoride that the dentist can apply on your teeth, and it will make your teeth stronger, very strong. The best time to apply this is 6 months to 15 years old, but even though you're an adult, you can still use fluoride. Fluoride varnish will still work. Tip number 10, if you still don't have caries, you can protect your teeth by applying sealant. We call it pits and fissure sealant because the teeth has grooves in it. Okay, there's lots of lines. Okay, and those lines are the ones that the bacteria and food get stuck on. The sealants will cover this area. If it is covered, the bacteria and food can no longer enter or get stuck in it, and it will be easier to clean. So sometimes I saw sealants that lasted 10 to 20 years. So there was no cavity for 10 to 20 years. Again, I'm Dr. Arkhe De Leon, the dental architect. You always remember there are two sources of happiness. That is to smile and to eat. So take care of your teeth. Thank you very much.